Hi. So, continuing with the section of disability and sexuality, let us talk about epilepsy and sexuality today. Epilepsy, that is also known as seizure disorder, is a brain disorder that causes recurring seizures. There are many types of epilepsy. In some people, the cause can be identified. Seizures can impact the brain processes. Epilepsy is very common. It is estimated that 1 in 26 people develop this disorder according to Epilepsy Foundation. Epilepsy affects people of all genders, races, and ethnic backgrounds, and even ages. Numerous studies have suggested that over half of men with epilepsy and one-third of women with epilepsy face issues in their sexual lives. The commonest problem faced by men are a reduced interest in sex and getting and maintaining an erection. Most of the men with epilepsy complain about this. So all these issues may be due to the areas of brain which control sexual functions, and they can be disrupted by epilepsy. For example, some men with temporal lobe epilepsy, it may be more difficult to get and keep an erection. They can't sustain the erection. Or there may be certain hormones that are needed to increase sexual desire and arousal. So in some cases, epilepsy can affect these hormone levels. Even some anti-seizure medications can reduce hormone levels or affect the way that hormones are broken down in the body. So because of all such factors, sexual problems may arise. Other side effects include tiredness, disrupted sleep, or feeling tense or depressed, which can also again affect the interest in sex. So when this happens, how you feel is more important. In general, we are more likely to want and have sex when we feel well and relaxed. But when we have low self-esteem, low confidence, feeling down or anxious, all this can affect how you feel about having sex. If you feel vulnerable, scared, angry, helpless, or under pressure, this may affect your sex life. The physical and emotional impact of seizures may affect your interest in sex. You may need time to recover after a seizure, deal with any injuries that may happen during the seizure, or may feel tired, fragile, or upset or anxious. Some people may fear having a seizure even during sex, especially if their seizures are triggered by physical activity or excitement or fast breathing. Normal sexual activity may provide a seizure, and quite possibly, certain types of seizures may stimulate normal sexual behavior. So anything can happen. Talking to your partner about what to do if you have a seizure during sex may help you both to manage this fear. Men with epilepsy are at a risk of decreased sexual functioning, including interest and sexual performance. Evidences suggest that people with temporal lobe epilepsy also have reduced genital blood flow. Psychosocial factors, including sexual anxiety and stigma associated with epilepsy, can also affect the performance or sexual life of patients with epilepsy. Physiologically, sex steroid hormone levels and testicular function can also be affected in men who have epilepsy. Most of women with epilepsy maintain normal reproductive cycles and sexual lives. Approximately only 20 to 30% have some degrees of sexual dysfunction, including problems with seizure increase, libido, arousal, and orgasm, or they may report painful sex due to vaginal dryness and vaginal spasms. So both men and women have different effects that because of epilepsy. And fluctuating hormone levels may contribute to an array of reproductive cycling abnormalities. With regard to sexual dysfunction, there is some evidence of reduced genital flow, in a woman with temporal lobe epilepsy. So both men and women, they may have reduced genital blood flow. Treatments for sexual dysfunction may include testosterone replacement in men. They can be given testosterone replacement. Even if this kind of problem has affected many, you may not have discussed it with your partner or doctor or someone else who might provide real support and help. So go and talk to your doctors. Doctors may be reluctant to bring up such intimate topics in the course of visit, and many patients do not feel comfortable in talking about sex. But this has to be talked about. Only 13% of epilepsy patients have had a conversation about sex with their doctors. Whatever the reasons behind the silence, there is no need to suffer. So you need to talk. There may be fear in you. Fear is often an underlying factor in sexual problems. You may believe that you will be rejected if the other person knows you have epilepsy. So you may not even try to establish relationship that could be intimate. So if you are hiding your epilepsy from your spouse, from your partner, that secrecy will create a distance between both of you. So you need to talk, you need to communicate and be honest. Also, you may be afraid that sex will provoke a seizure. If you think sex is a dangerous situation, you will enjoy it less and may even avoid it. But in fact, very few people report they have seizure during intercourse. Medications can also impact your performance, your interest, or your sexual life. When you take any kind of medicine, your body begins to function a little differently. You may eat less, sleep more, or feel drowsy. In the same way, seizure medicines can affect your sex life. Several common seizure medicines have been shown to affect hormone levels. So you need to be aware of what is causing problems in your sex life, or what is the major most hurdle in your enjoyable intercourse. And because of changes in brain due to epilepsy, certain damage to temporal lobe, it may leave people unable to recognize subtle cues that are part of establishing an intimate relationship. People with epilepsy often have a difficult time connecting with others. So all these factors can contribute to your lack of sexual satisfaction. Some may even not make friends. A study has found that 68% had no personal friends. Over half had never been in steady relationship. And there can be changes in the body systems. Both changes in brain due to seizures and extended exposure to seizure medications can affect your body functions.